Joining us now to discuss what's in the bill is Rhode Island Democrat Congressman David Cicilline. Nice to meet you. Nice to be with you today. Thank you.
Thanks for having me.
You're welcome. What in the replacement bill are you opposed to?
Well, I mean, the replacement bill is a great deal if you're an insurance company, if you're a drug company, if you're one of the wealthiest people in this country. But for hardworking, everyday Americans, it's a terrible deal. You just made reference to the pre-existing conditions. That only is available if you have continuous coverage. So if your coverage lapses, they can impose additional costs. But this is a program which is a huge giveaway to the wealthiest people in this country. It's a huge tax cut of about $7 million for each for the 400 richest families in this country. It makes devastating cuts to Medicare, to the Medicare Trust Fund. It makes devastating cuts to Medicaid, which is our most vulnerable populations, people with disabilities, children, nursing home residents, the most vulnerable communities. It allows insurance companies to charge more based on your age, so older Americans will face higher premiums. So this will raise premiums, reduce the quality of care, really undermine core programs like Medicare and Medicaid, and the best estimates are that 15 million Americans will lose insurance with the Republican plan. So, the president said, we're going to have a better plan, it's going to be cheaper, and more people are going to have access, everyone's going to have access to health care. This does just the opposite. It reduces the quality of care, it increases costs, and it makes it impossible for about 50 million people to continue to have coverage. So this is a terrible plan. The Republicans have been trying to sort of jam this through even before the Congressional Budget Office gives us an analysis, because what they're going to learn, what the American people are learning, is that this is very good if you're an insurance company, very good if you're one of the richest people in America, very good if you're a drug company, but very bad for everyone else.
Congressman, the GOP proposal is headed to the Budget Committee, which will vote on it next week. Take a listen to what Senator Tom Cotton told my colleague Casey Hunt this week.
We've got lots of time to get this right, and I'd rather get it right than get it fast. This bill, as written today, simply would not pass the Senate because it would not reduce prices for insurance and make care affordable and personalized.
What is the hurry, and can you envision any scenario where House leaders could hit the brakes?
I think Tom Cotton is exactly right that this does not reduce costs or make insurance more available. I wish he would speak to his Republican colleagues in the House who seem absolutely committed to moving forward. In fact, they forced a vote in the two committees of jurisdiction immediately. They worked through the night, like for 24 hours or something, because I think they wanted to get a vote before the Congressional Budget Office, revealed the very dire consequences for the American people if this act is passed. So they seem very committed to it. The president seems very committed to it. It took almost 2 years, hundreds of hearings, many, many amendments to do the Affordable Care Act. The president said the other day, who knew health care reform is this complicated? Well, we knew. It's very complicated, and we ought to be willing to fix the things that need to be fixed with the Affordable Care Act, but it's working. It has produced tremendous benefits for millions of Americans, and we ought to be prepared to work together in a bipartisan way to make it better and to strengthen it. But this idea of repealing it and replacing it with a plan which will really hurt the American people and cost 15 million Americans their insurance, really undermine Medicaid and Medicare, be a real boon to prescription drug companies and to the wealthiest Americans. It's a huge tax cut, an enormous tax cut for the richest people in this country. And who's going to pay for it? The health care of working people. This is a terrible plan.
Just quickly here, Congressman, what are you hearing from your constituents at home?
My constituents in Rhode Island are asking us to continue to fight hard to protect the Affordable Care Act. They have already seen the benefits. Rhode Island has 97% of our residents have access to affordable health care, which is the highest rate of insurance we've ever had. So almost every Rhode Islander is covered. They want to be sure that we're fighting hard to protect it, make sure young people can stay on their parents' plan until they're 26. There are no longer lifetime caps on insurance policies, making sure that pre-existing conditions are never penalized, making sure people are not discriminated because of that, and making sure that that healthcare is affordable and to be sure that the subsidies that are necessary so working people can afford to buy insurance remain in place. This is working. And look, we should be willing to focus on anything that needs to be fixed. I think Democrats have always been willing to do that. But what the Republicans are proposing does just the opposite. It makes it harder for people to have insurance, less people will be covered, and their coverage will be of a lower quality. And we've got to stop them. I think they're hearing from their constituents when they're home this weekend, and hopefully they're going to come back to Washington with a firmer understanding that they represent the people in their districts, the people of this country who want us to protect access to quality, affordable health care.
All right, Congressman David Cicilline of Rhode Island, we're going to have to wrap it up there. Thank you for joining us.
Thanks for having me.